Okay, Dr. Rucker here with Reverse Medical. I have Nurse Kelly on the line, and we're just going to cover a quick presentation that we have extracted the information from a blog because one of the patients Kelly was talking to had a question regarding a family history of breast cancer. And I'm going to provide a quick overview, and I'll let Kelly kind of chime in on any aspects of this. But the patient wanted to know if it was safe to use bioidentical hormone cream with estrogen, testosterone, and progesterone when she had a primary family history of breast cancer. In this case, the patient was 65 years old, and I'm not aware of what age her mother did develop breast cancer, but once again, Kelly
It
can
was
cover
late in
that.
life. Yeah.
Late in life. So here's a quick overview written by a family doctor. A lot of times I'll look at these overviews and use them as a set of bullet points for us to discuss. Here it talks about what is hormone replacement therapy. Obviously, we're talking about bioidentical. You can see here they talk about progesterone, estrogen. Usually, conventional doctors are talking about synthetic hormones. But a couple of the key features that I wanted to cover in this article written by a general doctor, women with a family history of breast cancer suggest that 1 in 7 women, period, will get breast cancer, and that's not because of hormone therapy. And it says here, it is estimated that only 10% of breast cancers that are diagnosed every year have a genetic or familial cause. So in a nutshell, my point is you have a relative of breast cancer, that genetics does not apply to you. I would only get more picky or careful if the patient actually had a primary history of breast cancer. So I believe it's absolutely safe to undergo bioidentical hormone therapy despite your family history, as long as you don't have a personal history. I do think it's reasonable that someone's done exams, and there's a lot of debate in the literature over the benefit of mammogram and screening mammography. I'm not going to get into that, but I just want to cover this one aspect. And then, Kelly, any other thoughts you have for anyone that may be watching this or any other comments you have?
Yeah, so I think if you could talk a little bit about the fact that the dosing and the way in which it is dosed, as far as the cream goes, that it's very low, and the risks of side effect with that actually is very low as well. So
Yeah,
doesn't that play a role?
that's a good point. If you look here in this article, they said if you take estrogen tablet form, you have a small increased risk of blood clot, but this is not present in the skin patch, gel, or spray. What's interesting is all these articles are writing about synthetic estrogens. We use bioidentical estrogen, and it comes in the form of estradiol and estriol. And let me see if I can find a graphic on that. So in this graphic, I pulled up 4 types of estrogens for us to discuss. You can see right here, you have E1 estrone, E2 estradiol, E3 estriol, and then ethinyl estradiol. I believe that's synthetic. That might be
Okay.
estrase, but I don't have to know because I know what's in our creams. We use E2 and E3.
Yeah. Okay.
And you can see the kind of the differences. So the E2 and E3 are breast cancer protective even. But I just wanted to use this graphic to show there's this many different ones, and the synthetic style are what most primaries use. So I'm going to go back to our other blog we were on. There it is. And so, yeah, back to your comment, sure. We use a low dose of a healthy bioidentical estrogen, and also statistically, when you have a family member, we don't have a heightened risk of concern, but we're going to look at each case on a case-to-case basis. And
Sure.
that's the conclusion of this segment. We're going to work on some other segments, including how the pump system works and some other ideas to add to the content for all of you. Thanks for watching.